All right, here we are in Boulder, Colorado. We're at foundation training certification. And one of the students who's also a physical therapist in a clinic that deals with pre and post-op spine disorders. He's got an awesome personal story that I think everyone out there needs to hear, especially if they're dealing with some pretty bad spine issues. And so, Joseph, why don't you tell us a little bit about what you were dealing with?
Well, first of all, thanks for having me do this. I'm 62 years old. I had a bilateral pars fracture when I was 22 years old and had to go back to college and do something else other than manual labor when I was around 28 and graduated as a physical therapist when I was 35. I've tried everything under the sun in terms of continuing ed and all the stuff that I've learned about my back. Everything has helped a little bit, but recently, just in the last 2 or 3 years, the spondylo started to slip a little bit further. Also, my L4-5 disc ruptured, and I had to have an emergency surgery to clean that up. They wanted to fuse me at that time. I asked for another option, and we took another option. So I wanted to hold off on the fusion as long as I could. About the same time, I was introduced to foundation training. I started practicing that. However, my back was really painful, and I had a lot of radicular symptoms down into my left leg especially. Started practicing foundation training at the same time. I was preparing for a 360-degree 2-level fusion. And that has the worst horror stories out there. That's what I treat. I treat these people. I try to get them up and moving again. So I knew what I was in for. As I started practicing foundation training, I started noticing that symptoms were starting to decrease. I started losing some of the symptoms that were down in my legs and really causing me a lot of problems. As time continued, I only had about 2 months left to get the surgery done because of how long that surgery is. There were only 2 slots left available at the hospital. The doctor I work with and his nurse, they said I had to make a decision pretty quick about the fusion because we were running out of time and there was no more slots available at the hospital. I asked him to please hold for a little bit. Something was changing. I continued to practice foundation training. If I'd had the surgery, that would have been November of last year. I have not had the fusion, and at this point, I do not plan on having the fusion. And the foundation training has just put the icing on the cake of everything that I know in terms of managing my spine. The foundation training got me upright, and then I decided I needed to go to a certification course and learn how to do this really well. And everything has been history since then. I look forward to what I can do with this as time goes on.
Wow, thanks, Joe, for sharing your story. It's so empowering to hear a practitioner, but also a patient, get the results like you did. And a lot of people need to hear this because it's life-changing.
It is. We use this with a lot of our patients. Of course, there are some that are not appropriate for it. But we're using this on the chronic spine. We're using this on the multi-surgery spine. Very complicated spine syndromes. We are trying this, we're modifying things to get them started, but we're getting nothing but positive results. We might get somebody sore, but we're not having increases in the compression syndromes. And so long as we're not doing that, we're on the right track.
Great. Thanks for sharing your story, Joe. Appreciate it.